Hi, I'm Dr. Erlach, and I'd like to talk to you a little bit about what causes tooth decay and why you might be having so much. Tooth decay is a multifactorial issue, and one of the big problems is who your mom and dad might be. Did they have soft teeth? Did they have a lot of decay? So part of it's genetic. Another part is where you grew up when you were a kid. Did you have fluoride in the water? Did you have good nutrition when you were a kid? Now, trouble is, with those two things, you can't do anything about it. So that's probably the last you're going to hear about it. Okay? So what can you do? What can you affect to minimize tooth decay? One thing is how often you eat sugar. That's the big one. It's not how much you eat, it's how often it's in your mouth. There's hidden sugar everywhere these days. For guys, it's often those Monster and Amped and Red Bull energy drinks. For the ladies, often it's Starbucks or some other sweet drink that is a treat, but it's sipped throughout the day. It's not guzzled down. So again, it's how often that sugar is passing over your teeth. Another thing is how well you're keeping them clean. The bacteria in your mouth that are always there are eating the sugar, and then they take the sugar and produce acid, which causes the tooth decay. So you can either don't feed them or knock their little bodies off your teeth. And best to clean your teeth in the morning when you wake up and before you go to bed, and floss usually at night is best. Once a day flossing is fine. And there's another issue, and it's the chemistry of your saliva. That's something that is very difficult to tell, but some people do not have a good saliva flow for whatever reason. It might be from medications, might be from some type of, God forbid, some cancer or radiation treatment that they had to have. Or it's just, it could be a genetic thing. So how well does that saliva that you have wash away the sugar? And the sugar bugs will affect your tooth decay. So if you have a particular issue and you're having more and more cavities, talk to one of the dentists or the staff at Fountaingrove Dentistry, and we'll try and get down to the bottom of it. We even have some tests.